Welcome back to The Explainer. So, if you live in or around Westchester, down in Miami, you know keeping your health on track during respiratory illness season is an absolute top priority. Today, we're diving straight into the primary care protocols over at Paradise Medical Center. We're going to see exactly how medical pros tackle these seasonal outbreaks. It's like a practical case study for navigating those absolutely miserable sick days. We'll look at the real science behind your treatment options and, most importantly, how to get you back on your feet fast.
We've all been there, right? Feeling under the weather is just a universal experience. But down here in South Florida, cold and flu season doesn't always play by the rules. It can strike at literally any time, catching us totally off guard. One minute, you're out enjoying the sunshine, and the very next, boom, you are completely sidelined with fatigue and congestion. When symptoms hit you that hard and that fast, you absolutely need prompt medical attention. But what you definitely do not want, and what this explainer is going to help you avoid, is that agonizingly long wait at the local ER, just sitting there surrounded by other sick people. No way. You need rapid relief. And figuring out how your local primary care options work is step number one to managing a sudden respiratory illness. So this brings us to the biggest question people face the second they wake up feeling off. How do you actually know if you have the flu or just a regular common cold? It's the classic dilemma, isn't it? You wake up, maybe you've got a scratchy throat, your muscles are aching, and your mind just immediately starts racing. Is this just a passing bug? Do I just need some tea and a nap? Or is this the start of a much heavier, full-body infection? Trying to diagnose yourself at home is so incredibly difficult because, well, the symptoms overlap a ton in those early stages. But here's the thing, the biological mechanisms of these viruses are completely different. Treating them exactly the same, it just doesn't work. There is a really brilliant contrast when we look at how these viruses actually behave. Colds, they develop gradually. You'll notice milder symptoms just sort of slowly creeping in over a few days. You know, a runny nose here, a little sneezing there, maybe a mild headache. The virus is taking its time, replicating relatively slowly in your upper respiratory tract. But the flu is an absolute ambush. It usually comes on completely out of nowhere with a high fever, severe body aches, deep exhaustion, and those awful chills. It literally hits you like a freight train because the influenza virus triggers a massive, rapid immune response in your body. Knowing exactly which viral invader you're dealing with dictates exactly how you treat it. And let me tell you, guessing incorrectly, that can cost you some seriously valuable recovery time. Now, a crucial piece of advice comes straight from the CDC. They highly recommend early treatment for the best outcomes. I mean, we all have that stubborn tendency, right? We just try to tough it out. We figure we'll just wait a few days, see if our immune system can handle the whole shebang on its own. But the medical consensus and the science tells us that waiting is honestly the wrong move. Early intervention isn't just about making you feel better faster. It is about stopping viral replication dead in its tracks before it hits its peak. When you attack a virus early, you drastically lower the viral load in your body. That's what gets you the best possible outcome and crucially prevents severe complications like pneumonia or bronchitis. Okay, so there is a highly specific biological window you absolutely need to know about when we talk about respiratory viruses: 48 hours. Early treatment is especially huge for influenza because targeted antiviral medications, things like Tamiflu, operate by essentially blocking the virus from multiplying inside your cells. But here's the catch. They are incredibly time-sensitive. I mean, they are at their absolute most effective when you start them within the very first 48 hours of your symptoms showing up. If you wait, say, 3 or 4 days to go see a doctor, well, the virus has already replicated to its peak levels. You've missed that critical window where those powerful medications can do their best work to shorten the flu and make it less severe. The clock literally starts ticking the very moment you feel sick. Section 1. The Paradise Medical Center Solution. Let's get right into it. Let's actually look at how clinics intercept that 48-hour window. We're using Paradise Medical Center in Westchester, which is run by Dr. Teresa Marino, as our case study here. Their workflow is honestly incredibly seamless. Step 1, just call for a same-day sick visit. Skipping the multi-day wait for an appointment is really the only way to beat that biological clock we just talked about. Step 2 is rapid 15-minute testing. Instead of doing the whole routine where they draw labs, send them off, and make you wait days for an answer, they run in-office influenza A and B testing. You get a definitive diagnosis in exactly 15 minutes. And step 3 is immediate treatment. Armed with those rapid, highly accurate results, they can immediately prescribe the targeted medications you need while you are still well within that crucial 48-hour window. It's a system built entirely around speed and accuracy. Going beyond just a basic diagnosis, a truly comprehensive primary care approach doesn't just hand you a tissue and send you packing. They offer a full suite of targeted respiratory care. This ranges from prescribing those crucial antiviral medications to shorten the flu's lifespan, all the way to actively managing the symptoms that are making you absolutely miserable. So that means getting prescription or over-the-counter recommendations perfectly tailored to your fever, your congestion, or your body aches. They also run rapid testing for strep throat and COVID-19. You really want to completely rule out other dangerous culprits that mimic the flu. And for patients who are dealing with wheezing or deeper respiratory issues, they can even administer breathing treatments right there in the office using a nebulizer. Plus, and this is super important, they do structured follow-up care to make sure your lungs are actually clearing up and recovering the right way. Okay, let's shift gears for a second and address a super common anxiety. When should you actually see a doctor? We've talked a ton about the benefits of catching a virus early, but there are certain urgent red flag scenarios where waiting it out goes from being simply uncomfortable to being potentially life-threatening. It is absolutely vital to know when your body is sounding the alarm. It's telling you that professional medical intervention is no longer optional, it is mandatory. It is so crucial to memorize these red flags. Listen up. You need to see a doctor immediately if you have a fever spiking above 103 degrees Fahrenheit. That indicates a really severe inflammatory response. If your symptoms are just lingering for more than 10 days without getting any better, that is a huge warning sign that a secondary bacterial infection might have snuck in. And if you experience difficulty breathing, chest pain, or severe vomiting that leads to dehydration, do not wait, go. Furthermore, if you fall into a high-risk group, meaning you're elderly, pregnant, or have chronic health conditions like asthma or diabetes, your threshold for seeking care should be much, much lower. For these groups, the risk of serious complications like pneumonia is just way too high to ignore those warning signs. All of this builds into a vital long-term health strategy. Prevention is the best medicine. Treating a severe flu effectively is great and all, but completely avoiding the infection in the first place? That is fundamentally better for your body. Primary care practices like Paradise Medical Center emphasize proactive care right alongside those rapid treatment protocols. By offering annual flu vaccinations and comprehensive preventative care, they help keep your immune system armed and ready year-round. It's basically a dual approach to healthcare. You defend your body ahead of time by training your immune system with a vaccine, and then you have a rapid response medical team standing by, ready to jump in if those initial defenses are ever breached. So, as we wrap up today's explainer, remember, if you are in the Westchester, Miami area, and those telltale symptoms start creeping up on you, you can call Paradise Medical Center at 305-676-8217 to lock in that same-day sick visit. They're located right at 8380 Southwest 8th Street. Honestly, understanding your local healthcare resources and the biology of these viruses before you actually get sick, it's the ultimate life hack for staying healthy. So, I want to leave you with this thought. Now that you know exactly how fast a respiratory virus can escalate and exactly what rapid response resources are sitting right there in your neighborhood, will you be ready to act the second that 48-hour clock starts ticking?